Hi, I'm Maria Silvia, and I'm from São Paulo, Brazil. And I will talk about manual therapeutic techniques, manual lymphatic drainage, fascial and cicatricial release. I'm graduation at physiotherapy from Methodist University of Piracicaba. I'm specialist in dermatofunctional physiotherapy from the Brazilian Association of Dermatofunctional Physiotherapy. I'm a master's at education from Methodist University of Piracicaba, and I'm a PhD at functional and molecular biology physiology from University of Campinas. I was coordinator and professor of course in physiotherapy from Methodist University of Piracicaba. This chapter had these co-authors. The manual lymphatic drainage, MLD, is a kind of massage and has been used to promote fluid reabsorption of edematized tissue, and because that's an important component in the treatment of lymphedema. Manual lymphatic drainage is a massage method characterized by extremely precise, smooth, and superficial, slow, monotonous, and rhythmic maneuvers with a proximal start and follows the pattern of lymphatic system. It can be considered a manual therapy technique. The anatomophysiology and regeneration lymphatic system. The lymphatic system is seen as annex the venous system, as it drains the lymph from the interstitial space and releases it through its vessels and on formations into the venous stream. The lymphatic vessel system is formed by initial lymphatics with origin the intercellular space of connective tissue, pre-collectors, lymph collectors, and lymph ducts flow into venous angle at the confluence of the jugular and subclavian veins. The initial lymphatics are formed by layer of overlapping endothelial cells, forming junctions that may have very narrow openings that allow only the passage of fluids and small or larger molecules allowing the passage of macromolecules. They have externally filaments that stick to neighboring tissue, called fixation filaments, or encourage that when pressured open the endothelial junctions. From the pre-collectors, the lymphatic vessels have valves with centripetal orientation to the lymph nodes. The lymphatic vessels present a segment delimited by proximal and distal valve, which is called lymphangium, configuring the moral unity of lymphatic system. Here we can observe the lymphatic vessels above the blood vessels. The thoracic duct receives lymph from the infradiaphragmatic portion, from the left half of the chest, from the left upper limb, and from the neck and head. They originate along the interior surface of the second lumbar vertebra in a small formation called kilo or piquet cistern, and flow into the left subclavian jugular confluence. The right lymphatic duct is formed by jugular, subclavian, and right bronchomediastinal trunks, which drain the head, face, and neck, the posterior part of the cervical region, the right upper limb, and the left hemithorax, ending at the right subclavian jugular confluence. The lymph nodes has the mission of recognize, detect, and neutralize harmful elements such as bacteria, viruses, etc., which are found of the lymph. They work as a filter, not allowing unpurged lymph to reach the blood. In the lymph nodes occur most of the immunological reactions that are present in the organisms, as the lymph node also plays the role of cell production. All the cells are the two main types, lymphocytes and plasma cells. Furthermore, it gives rise to macrophagic phagocytosis in lymph nodes. We have 11 trunks. The low back drains the lower limbs, urinary and genital system, lower abdomen, inferior mesentericary structures. Intestinal drains celiac and superior mesenteric lymph nodes. The bronchomediastinal drains these areas. The subclavians drain these areas. Jugular drain head, face, neck, and posterior cervical region. Intercostal descendant drain these regions. Manual lymphatic drainage aims to restore or maintain the water electrolyte balance, the function of lymphatic system, and consequently human health. In addition, it's important on immune system. William et al. In their review mentioned that MLT has an effect on the autonomic nervous system, producing calming effect, as well as dyspnea decrease and sleep improved. In addition to these effects, some research has shown that MLD has other system effects as reduce stress and tension, promotes relaxation, decrease sympathetic, and increase the parasympathetic response. The vasculature, the lymphatic system, plays an important role in regulating the inflammatory response, as it promotes drainage drainage of extravascular fluids, mediators, and inflammatory cells. In this paper, the authors mention that the drainage performance of lymphatic vessels is influenced by vascular permeability and pumping activity, which are influenced by VHGFC and VHGFR3 signaling, as well as several inflammatory mediators, including TNF-alpha and interleucin-1 beta and nitric oxide. In the same work, the authors mention that activating the lymphatic vasculature in the setting of skin inflammation has been associated by reduced disease severity. In contrast, the stimulation of the lymphatic vasculature inhibiting lymphatic vessels has been shown to aggravate skin inflammation in several studies. In a plastic surgery, we have incisions in two planes, which also lead to damage to lymphatic vessels, which will need to be repaired. The increase in lymphangogenesis is related to increasing production of different vascular endothelial growth factors with expression of metalloproteinases and migration of lymphatic endothelial cells. Migration of lymphatic endothelial cells depends on channel formation in the regeneration region to migrate lymphatic endothelial cells. Then, the manual lymphatic drainage is very important to this channel's formation. The lymphatic endothelial cells migrate as single cells and organize themselves unidirectionally towards to interstitial fluid flow, which later merge into vessels, unlike angiogenesis that occurs in a randomized fashion. On the other hand, in experiments carried out on rats' tails, demonstrated that if the flow doesn't remain functional, the infiltrated lymphatic endothelial cells do not organize themselves into functional vessels, although there is scarring of the skin. The mechanisms of action, effects, indications, and adaptations for the use of MLD in plastic surgery. So, reduce the circumference and volume of the segments, improving post-operative discomfort related to sensation of redness, pain, pressure, etc. It has an inflammatory effect, including reducing inflammatory markers, increase blood circulation and superficial arteries and veins, which may improve wound healing. It has a sympathologic effect, production, a calming and sedative effects, reduction, pain and muscle tension. Fluidize the contents, the most consistent edemas. Regardless of the MLD technique, the stages of the healing process, the tensile strength of the tissue submit to the surgical procedure. The territory to be targeted must be respected. Special care must also be taken with the traction component, especially in flap in the early stages, and to avoid the application of sliding maneuvers and skin tractions, reducing the risk to integrity the blood and lymphatic vessels in new formation. In liposuction, the physiological direction is adopted as the superficial drainage areas, while in detachment surgeries and with use the surgical flaps, it's recommended to observe the place of the origin of the flap and its current position for readjusted to drainage direction. In an evaluation by lymphoscintigraphy of the lymphatic drainage of abdomen after abdominoplasty, it was observed that in a preoperative period, 100% of the patients present the direction for the inguinal lymph nodes as a pattern of the superficial lymphatic drainage of the abdomen. After 30 days and 6 months, the direction of lymphatic flow towards the axillary lymph nodes was observed in 65% patients. The importance of manual lymphatic drainage, how to prevent adipogenesis and fibrosis. In this study, if lymphedema is not resolved, the affected tissue manifests changes that include chronic inflammation, fibrosis, and adipose tissue accumulation. Here we can see a normal lymph and with chronic lymphedema with increased adipose tissue thickness. In this study, the authors demonstrated that lymphatic fluid stasis leads to an increase in adipose tissue in swollen tissue by hypertrophy as well by adipocyte hyperplasia. The lymphatic fluid stagnation increases the expression of adipocyte differentiation markers that regulate adipogenesis. In this study, suggests that interleukin 6 is increased as a result of adipose deposition and CD4 plus cell inflammation and lymphedema. Here we can observe the lymphatic vessel with collagen type 1 that characterize fibrosis in lymphatic vessel. When possible, they can be used as MLD maneuvers with displacement of skin in the order by 1 centimeter will be more effectively the lymphatic reabsorption. This displacement may, in some circumstances, favor the mechanotransduction states necessary to generate TGF-beta-1 reduction and myofibroblast apoptosis reduction fibrosis. Fascia and plastic surgery. The fascia is a fibrous connective tissue considered the second human skeleton, with continuous characteristics, interconnection of body system. It played an important role in the transmission of mechanic forces during posture change. It works as a three-dimensional matrix of structural support and influence in the functionality of all the system. It's divided in two layers, superficial and deep fascia. Superficial and deep fascia. Fascia functions are synthesis of proteins such as collagen and elastin, coating, protection, tissue and organ separation, stimulation of lymphatic circulation in body fluids, transmission and distribution of tension over the body, provides muscle shape and directs the force of contraction, participation in the muscle coordination process, nutrition of adjacent tissue, facilitation of movement through lubrication provided by interstitial fluid. The surgical act causes damage of tissue, which can lead to complications such as a formation of abrasions, fibrosis, and nodules palpable. A thick fascia restrains the lymph flow, increasing edema and delayed tissue repair. Fascial release has the goal to lengthen and smooth the connective tissue through the mechanical stresses applied to tissue in healing that promotes the collagen bundles organization into a more natural way. Release adjusts the central activity to scar tissue formation. Thus, it contributes to the formation of collagen bundles, improves orientation, and restores normal tissue function. Here we can see that the result of 4 sections of fibrosis treatment after liposuction. Tissue mobilization of the area adjacent to the scar in the initial post-surgery phase. It's possible to note that the protection of the scar is by the dressing. The allowed movement for mobilization are lateral shear to right, left, and approximation of edges of the scar. The edge should not pull apart during mobilization to avoid increasing the extrinsic strength of the recent scar. After complete closure of the scar, manipulation can be started above it. The movement must be slow, and tension plus compression plus shear must be performed according to the malleability of the tissue. The strength of the stretch will be proportional of the strength the tissue offers. Transverse friction massage and vibration to reduce stiffness and scar adhesion. Transverse friction along the area adjacent to the scar in the initial phase of postoperative. Note the protection of the suture edges with microporous tape. Permitted movement are edge approximation and transverse friction. Myofascial induction therapy, MIT, is a manual treatment used in physical therapy that aims to restore the altered function of the fascial tissue. This method aims to remodel the connective tissue through the application of different mechanical techniques. It also calls mechanotransduction, a biomechanical effect on tissue that aids in the remodeling process, improve elasticity, and reduce collagen and myofibroblast excess in the scar area. The techniques used at MIT are noted in the table. In conclusion, manual therapy techniques are essential tools for the patient care of plastic surgery, whether in the prevention or on the improvement of complications, sequelae that may affect them, and must always be prescribed and applied according to a rigorous initial evaluation and constant physical therapy evaluation subsequent one. Thank you.